Hi everybody, so here's August P&OD cast, so following on from staff brief at the end of July. First off, I want to say thanks and welcome to a range of people within the Directorate that I've been meeting over the past few days. Too many to sort of name them all, but it's been great to see the enthusiasm from the new starters and the welcome that you've all given them as well. General reminder, can we make sure everybody knows about the staff Facebook page and the P&OD Facebook page as well, because I think we're sometimes forgetting to encourage everybody to use those, so please do that. I had an interesting discussion at our senior leadership team last week, tied in with the quality improvement approach and about visual management boards. And I know already some teams have started looking at what they might have on a visual management board, so thinking about what are the key things that they're working on, are they going well, what do we need to try and break through some of the challenges that we've got. So as a senior team, we're looking at what sort of visual management board should we have as a senior team, so we can see at a glance the progress that we're all making. And so I'd encourage all of you as teams just to think about maybe do you use huddles to think about how the week's been going, how the month's going, and thinking about your KPIs or celebrating things as well. So Jane Collingwood's working with Martin from NHS Improvement to think about what that visual management board might look like. And also we're exploring how we might make that digital as well, because we're conscious we do operate across all three sites. A couple of visits I've done this month to C Block and also to the hub at Bassetlaw. Bit of a drop-in session, but also meeting the team over at C Block. So really, again, the level of enthusiasm there, the ideas, and very much, I think it was that really hot week as well, so the impact of needing water. So looking at how we maximise that, but so it was great to see that, and I'm trying to make sure I do come out to all of the teams and wander around and see you. Just a reminder, we've got a couple more of Richard's staff engagement forums coming up, so one on the DRI site and one on the Bassetlaw site, so watch this space for those and encouraging you to go along to those. Be good to have representation from across the Directorate. Keen to have a mix of managers and colleagues to contribute to ideas as to how we continue to make improvements of working here at Doncaster and Bassetlaw Teaching Hospitals. You may have picked up, we've got CQC coming along soon, so you'll have seen, I hope, on a Facebook page that Cindy Storer did a lunchtime lecture last week, and that has been recorded and put on the Facebook page. But again, those lunchtime lectures are being repeated the Fridays through August. So encourage you to go along just so you can get a sense of what CQC will be coming to look at, the 5 domains that they focus on, and also just to hear what really good news that we've been doing, the work that's been going on about ensuring that patients are communicated well, that we're sharing how we care with patients, but also staff as well. And I've been really impressed by Adam's asked for the last sort of 3 weeks, what have you been proud of over the last week? And I think the overwhelming sense I've got is the support that teams are giving to each other. Along with CQC, so one of the domains that gets assessed is about the well-led domain, but tied in with that is also an assessment about use of resources. So looking at how we use our drugs, our people, our finances, our estate, in terms of what's our data telling us and then what improvements are we making. So we had a meeting this morning with Cathy Kennedy from NHSI, who will be chairing our assessment, just to try and get underneath what we need to be thinking about. So part of what we're putting into our evidence is how we've been introducing new roles, the TNAs, the TAPs, the ACPs, to sort of actually supplement the vacancies that we've got. So some important assessments coming up during September and October. Another piece of work that we want to start looking at is just culture. So Merseycare have done a lot of work about let's not automatically go for disciplinary hearings, how do we actually have that just and learning culture, and there's a lot of evidence that can also improve patient care as well. So we're going to start thinking about what that might mean for us as a journey over the next 4 or 5 years, and we're really going to start that conversation happening on that, so again joining with you on that. Of course, this week's been junior doctor changeover and all the new doctors joining us. So popped into the Education Centre this morning, so today being Wednesday changeover day, and even at 7:15 they were arriving. So again, thank you to everybody that's been involved in that. And of course yesterday we had the newly qualifieds event in terms of welcoming the nurses, midwives, AHPs and the like who will be joining us over the next month or so. And again, thank you to everybody. It looked a really well run event. The work that's going on is obviously about the medical roster system being introduced. So again, with the junior doctor changeover, we've introduced that for junior doctors in medicine in terms of their roster management. We're shortly going to be going live with consultants and their annual leave management, and then looking at the e-job planning. So again, kind of hitting a sort of crescendo just at the moment. And of course, track. I think that's really starting to be embedded now. Listening to people at Vacancy Control Panel, which I've just been doing, that colleagues are finding it much more straightforward, and it seems to be cutting out some of the waste in some of the processes. So again, that's great. So some core performance. So certainly in terms of appraisal and set within our directorate. Above 90% for both of those, so great news on that front, so thank you. I think those that haven't had appraisals are because they've not been here at the time we've been doing the appraisals. And across the organisation we know there's some stragglers there, and I know all of you are working with those teams to ensure that we do get everybody's appraisals done. And again, we really are feels like we're starting to be on the homeward stretch to get to 90% per set across the organisation. So really trying to push those straggling areas and topics. Sickness, still struggling in terms of trying to really get that down. So what I've asked Anthony and the team to look at is, can we try and identify those sort of top 10, 20 people within divisions and directorates that have got high sickness rates, and understand why that is the case, and how can we put action plans in place to reduce those sickness rates and have them at work, because clearly we have a few vacancies, but often it's the sickness that is impacting then on that continuity of cover. The other two pieces of work that we've just been doing is the Workforce Race Equality Standard and the Workforce Disability Equality Standard. So papers went to the board last month about that. The two particular areas that I've asked us to look at is in terms of recruitment. The information is suggesting that BME staff are less likely to be appointed once they've been shortlisted, so we need to get underneath that data. And then also from a disability perspective, that disabled staff are more likely to be in formal capability procedures, capability being sickness procedures. So again, wanting to get underneath that data to understand that and how we might improve that information for us. Also, I'm not sure when this will exactly go out, but 17th of August, we've got Pride, Doncaster Pride. And again, good to see some of that on the Facebook page as well, in terms of encouraging colleagues to attend that. By all accounts, it's a great event, and we are joining with RDash and the CCG on the health bus, and also we've got a stand there as well. So encourage you and colleagues to pop along to that. Financially, we were slightly ahead of plan. Still a deficit, but I say slightly above plan, better than plan, but within P&OD we're still on track in terms of our budget. So again, thank you for ensuring we don't just spend, and we really think about what we are spending our money on. RTT and 4-hour access, fair to say we're not hitting the national target. We've got action plans in place as to how we improve for the RTT. 4-hour access, we know we still do well in comparison to other organisations, but again we do have that target of 95% that we are aiming to achieve. I think that's the key messages on that. Again, I think many of you are away on holiday at the moment. We'll be coming back all refreshed. Those of us that have already had our holidays, yeah, we're looking forward to our next. But thank you for everything. Reminder, we've got Star Awards coming up. So that's on the 19th of September. Please do buy your tickets, and great that we have got some of our teams that have been shortlisted as well, so that's really good news. So thank you to everybody for the contribution. See you soon.